Here's the deal. Millions of people rely on Medicaid for healthcare, and soon that access to coverage could be changing, especially if you live in a rural area. If you're new here, I'm Kirsten Garris, and this is Here's the Deal with KG, where I break down some of the biggest stories nationwide. This video is also a collaboration with Get Real, America's first grassroots newsroom. So, y'all remember that One Big Beautiful Bill Act? Well, that new law has major cuts to Medicaid. We're talking about nearly $1 trillion in cuts over the next 10 years, and that could have a big impact on your access to healthcare if you live in a rural community. You already know, there's a lot to unpack. I got my notes, so let's talk about it. So when it comes to Medicaid, doctors say this system is really complex because it serves many different people in several different ways. And the new law has a lot of new changes that can make things more complicated. And this is the complicated that I was talking about. The new law adds some new work requirements to determine if you're eligible for Medicaid coverage. This means some people may have to stay on the job longer, others may have to show they're volunteering or doing some kind of training to get their benefits. During a recent virtual news briefing, doctors warned that some of these changes could lead to some unintended consequences for patients.
There are going to be winners and losers, and there are going to be people that are going to, unfortunately, suffer and die because they won't have access.
Now, turning to the White House, officials there are touting some new investments in rural healthcare in this new law. We're talking about the Rural Health Transformation Program. Now, this will provide $50 billion over the next 5 years to rural areas in states that qualify. But here's the catch. New analysis from KFF shows that this new law reduces federal Medicaid spending in rural areas by $137 billion over the next decade. So the math isn't quite mathing here. And healthcare administrators say this will cause hospitals to make some tough decisions along the way.
So when we have to close services, or when clinics have to close services or change things, that impacts the entire community, not just the Medicaid population. Whether you're on Medicare or you have commercial insurance, this is going to impact your community one way or the other.
And on top of all that, federal estimates show that this law will likely lead to 10 million more Americans not having health insurance by 2034. Now, if you'd like to contribute to Get Real, check them out on social media on TikTok, Instagram, Facebook, or YouTube. You can also go to their website, getrealnews.org. All right, y'all, that's it for now. Talk to you later.